I'd like to welcome all of you to this first webinar from the Center on Commercial Determinants of Health, located at the Milken Institute School of Public Health at George Washington University, here in Washington, D.C. in United States. My name is Adnan Haider. I'm the Senior Associate Dean for Research here at the Milken Institute School of Public Health. I'm also a professor of global health, and I'm delighted to be director of this new center that we've established. Welcome to all of you joining from all corners of the world, I hope. I'm really excited to have this kickoff webinar today. I'm going to be particularly excited as I welcome our panelists in a minute, but also thanks to all of you for joining us today. We're going to focus today's webinar on commercial determinants of COVID-19. As we all know, we are in the midst of a global pandemic, and this pandemic is affecting many, many things, but it's also made more visible and more acute many of the underlying determinants of health, whether they are systemic racism, or it's the role of private industry, or it's the social justice and equity issues that many of us have been fighting for many years. It is important, therefore, that in the presence of this global pandemic, we talk about the implications of COVID-19 and commercial determinants, particularly for public health practice and advocacy on one side, and indeed for public health policy. And in today's world, especially from the country where I'm speaking to you from, the role and the importance of evidence and science. I hope that that will be very clear, and we will get into that in our discussion. Once again, I welcome you all. Please use the chat board for comments, for questions. We will be monitoring the chat board very closely throughout this discourse. In order to give you a real welcome on behalf of the center, I'm really excited to welcome my colleague and Associate Director of the Center on Commercial Determinants of Health, Dr. Nino Pachadze. Dr. Pachadze is not only our Associate Director, but also an Assistant Research Professor in the Department of Global Health. She comes with over a decade of experience, not only in the academy, but also in the private sector. And so she speaks to this topic from her heart. Nino, I'd like you to offer a welcome from the center and give a very brief introduction of the goals and mission of the center. Over to you.
Thank you so much, Dr. Haider. Welcome, everyone. I'm very excited to see everyone here, such a good participation, and I'm going to spend just a few minutes introducing our new Center on Commercial Determinants of Health. The aim of our center is to address the growing burden of non-communicable diseases as well as injuries caused by commercial determinants of health globally. The special focus for our center is on vulnerable populations, including children, adolescents, youth, women, as well as poor. And we believe that our center is one of such research centers that focuses on issues of health and safety and private sector engagement in public health. The mission of our center is to understand, analyze, address the mechanisms of growing burden of mortality, morbidity, as well as disability from commercial determinants of health. We strive to bring transdisciplinary perspective, scientific rigor, evidence-informed approaches to studying and transforming role of industry in public health, both locally in our city of Washington, D.C., nationally, globally as well. And we include such areas as looking at ethical, legal, and social implications of commercial determinants of health, health and development, and implications for health system strengthening, regulatory and policy guidance. The objectives of our center are to develop theories, concepts, frameworks, and methods for study of commercial determinants of health, to conduct multidisciplinary, rigorous scientific research, to support evidence-based advocacy to address commercial determinants of health, to influence the inclusion of sound policies and regulations on commercial determinants of health globally, and to train and build capacity on research and action on commercial determinants of health. In terms of strategies, we are focusing on 7 strategies, including analysis, which includes conceptual analysis, rigorous research, monitoring and evaluation of interventions, as well as policies and regulations on commercial determinants of health. We're trying to understand ethical, legal, social implications of commercial determinants of health, and disseminate and communicate our findings from our work to public, private sector and civil society, convening of thought leaders, experts, and key stakeholder groups to facilitate discussion and production of ideas locally, nationally, and internationally around commercial determinants of health is another strategy. We're interested in collaborating and partnering with public sector, non-governmental organizations, UN agencies, and donor organizations. Training and capacity development, which includes short-term as well as long-term trainings, online and executive courses, and providing technical assistance to public and private sector and non-governmental organizations are two additional strategies that our center focuses on. And this is briefly about our center, and I'm delighted to share our contact details. If any of you have any questions, please feel free to email us at ccdh_gwsp@gw.edu. We just launched our website, so I would encourage you to visit our website and learn more. It's still in building phase, so be patient with us. But of course, I would highly encourage you to follow us on Twitter and Facebook as well. So thank you, and I'm delighted to be here.
Thank you very much, Dr. Pajadze. Really appreciated. So ladies and gentlemen, that was a brief update, really, on behalf of our center here on commercial determinants of health. We welcome your collaboration and your participation in our initiatives. I will request my colleagues to actually repeat the email and the website in the chat board as well. I now want to also welcome additional colleagues who've just joined us from the waiting room into the main webinar. Welcome to everyone again. For those of you who were just joining us, in another 4 to 5 minutes, we'll be closing the webinar. I hope that anybody who is intending to join, we are delighted to have such a wonderful audience from around the world of many individuals who are scientists and expert yourselves. However, I'm really honored today to welcome our first panelist from outside GW, Professor Nicholas Freudenberg. Professor Freudenberg, for those of you who don't know him, is a distinguished professor of public health from the City University of New York School of Public Health. He's actually been working on these types of issues around commercial determinants for a long time. He's also director of the Urban Food Policy Institute at the City University of New York, and has published a book on this issue, very appropriately labeled Lethal But Legal: Corporations, Consumption, and Protecting Public Health. I know that Professor Freudenberg is working on additional books as well. He comes with a wealth of knowledge, and I'm truly delighted, Nick, that you could join us today and share your thoughts about commercial determinants in COVID-19. I believe my colleague will now put up your slides, and over to you for your opening reflections.
Thank you so much, Adnan and Nino, for having me. It's a real honor to be here to discuss this critical issue. Lest you fear or hope, based on the image in this first slide, that I'll give a talk ripped from the headlines of today's stories about COVID-19 and its economic consequences, I can either reassure or disappoint you that that is not my intention. Rather, I hope to take a step back from the current news to ask how we can better understand the complex relationships between the current global and economic political system that I call 21st century capitalism and the COVID-19 pandemic. I'm interested in a deeper understanding of both how this system contributed to or deterred the rapid spread of infection over the last 8 months or so, and how this system has shaped business, government, and civil society responses to the pandemic. In my view, using the emerging framework of commercial determinants of health to illuminate the reciprocal relationships among COVID-19 economics, politics, power, and health offer the opportunity to develop insights that can inform public health and social justice. In the next 15 minutes or so, I hope to suggest some answers to these 3 questions, and then to hear your reactions and suggestions for deeper understanding of how commercial influences have shaped COVID-19 and the societal responses. Researchers on determinants of health are still working to come up with a widely accepted definition of the term. With colleagues in the United Kingdom, Canada, Australia, Brazil, United States, and other countries, I'm part of a group working to contribute to this effort, and we really welcome the new center at George Washington as part of that effort. And here's a proposed working definition. And some of the features of this definition, as noted, are that it considers both a negative and positive impact of commercial determinants. I think having that equipoise perspective will give us deeper insights. It analyzes the structures as well as the businesses and political practices of commercial actors, including corporations, trade associations, financial institutions, and so on. It moves beyond an exclusive focus on unhealthy commodities and non-communicable diseases, the categories that have rightly attracted attention up till now, to look more broadly at other health outcomes. And it sees commercial determinants as both a subset and an alternative perspective to social determinants of health. It suggests that we don't need to choose between one or the other, but we need to understand how they're integrated. To understand the world in which COVID-19 emerged, we need to look at these 5 key characteristics of 21st century capitalism. The first is rapid globalization, enabling capital, goods and services, people, ideas, and pathogens to move around the world with lightning speed. Since its inception, capitalism has always been a globalizing force, but the speed and intensity of that movement is what distinguishes this era. Financialization describes the process where financial transactions, rather than manufacturing, have become the driving force in the world economy. It puts intense pressures on all corporations to match the profits that can come from financial transactions, and also contributes to the stark inequalities that have facilitated the spread of COVID and its disparate impact. Deregulation, the lifting of public oversight of businesses that began in the 1970s, and privatization of formerly public services such as healthcare, education, sanitation, and policing, has diminished the capacity of governments to protect public health and to reduce harmful business practices. In addition, failure to enforce antitrust laws have enabled a handful of giant corporations to dominate almost every sector of the economy. Over the last 50 years, businesses have won increasing control over new developments in science and technology. In food, pharmaceuticals, medical technology, social media, intellectual property rights, trade agreements, and others have diminished public control and use of science and technology to benefit humanity and the planet, and rather than to increase profits. And finally, we've seen the rise of a corporate ideology that paints individuals as being responsible for their own health, markets as the wisest arbiters of political questions, and freedom as the right to choose what to purchase without interference. This ideology has made it far more difficult for governments, civil society, and businesses to agree on a plan of action to control COVID-19. Next slide, please. In summary, as shown in this figure, changes in capitalism have led to changes in living conditions that have facilitated the rapid spread of COVID-19 around the world and its concentration in the most vulnerable populations. Among the specific cofactors associated with COVID-19 infection or early death are obesity and diet-related diseases related to the rise of ultra-processed food and the food industry, air pollution, crowded housing, and crowded, unsafe working conditions. All essential characteristics, features, not glitches, of our current political and economic system. Similarly, changes in 21st century capitalism have shaped the societal response to COVID-19, diminishing the capacity of almost every sector of society to respond quickly, effectively, and efficiently. To take just one example, austerity and tax cut-induced cuts in public health spending at the local, state, and national levels here in the United States, but elsewhere as well, over the last several years, have made it harder for public health authorities to launch effective surveillance, emergency response, contact tracing, food security, and other critical programs to respond to the pandemic. This analysis, I acknowledge, is grim, and its implications that business as usual, even faster or more competently led business as usual, is not going to either end this pandemic or address the underlying conditions that have allowed it to flourish. But here's the silver lining, and public health always looks for silver linings. That's what we do. To fix COVID, we need to fix the deeper social problems that are endangering human and planetary health. As Naomi Klein has said about climate change, COVID changes everything. So what are some of the starting points for getting to another world? I suggest 5. We need to expand our research framework, change the rules, redraw government and business responsibilities. We need to determine that we're not going to go back and that another world is possible. On research, understanding how to learn from the natural experiment that is the COVID pandemic offers public health and other researchers interested in a deeper understanding of commercial determinants of health a cornucopia of research questions. And I list some of them here, and maybe you'll have others in the discussion period. Since the beginning of capitalism, the rules that govern the proper roles for business and government have changed often and dramatically. Only 50 short years ago, when I first started studying and working in public health, activist movements forced the government in the United States to better regulate the environment, protect worker health and safety, take on racist housing and healthcare practices that threatened the health of Black Americans, and make changes in how healthcare was delivered to women. The reforms in public health practices that these movements won reduced corporate power, but also triggered a business backlash, which has yet to reach its peak. By focusing public education and organization on making the changes listed here over the next 5, 10, or 20 years, we can help to create new rules better designed to protect public health in this century. And each of these changes would bring direct benefits to the control of COVID-19 and subsequent epidemics. These are the questions we need to ask as public health professionals, researchers, and citizens. Some of my colleagues in public health believe that it is not proper for us to be asking these political questions. But I believe, if not us, who? The great successes of public health in the last 2 centuries have come when researchers and professionals have joined reformers and social movements to analyze and change the circumstances that make people sick. Today, in my view, public health action that can modify the commercial practices, policies, structures, and norms that are the fundamental causes of so many of the world's health and social problems is a promising strategy for fulfilling our obligation to act to promote population health and reduce health inequities. Arundhati Roy, the Indian writer and political activist, has said, another world is not only possible, she is on her way. On a quiet day, I can hear her breathing. Workers and labor activists in responding to COVID and organizing meat plant, agricultural, food service, and other workers have raised the slogan, no going back. The goal is not to return to pre-COVID days, but rather to take this challenge to take on some of the underlying threats. COVID-19 presents our generation with the opportunity to write the next successful chapter of public health history, a history of slow but steady progress in improving the health of the world's population, reducing inequities in well-being, and contributing to a fairer, more sustainable world. Let's get to it. Thank you.
Thank you so much, Professor Freudenberg. This was really a fantastic start to our dialogue. I think that your positioning of some of the issues are very, very critical for us. And thank you for challenging the academic and the public health sector as well. I really enjoyed the fact that you're starting with your three very overarching questions about what are the recent changes in the market sector, how do they influence the societal response to COVID-19, but also the fundamental question about what are the opportunities that COVID-19 offers us in terms of looking at these commercial determinants of health. I hope that we'll come back to some of these issues and we'll pick them up in the discussion section. So thanks again for your remarks. I'm now very excited to welcome our second external speaker for the day, Lucy Westerman. Lucy is the Policy and Campaigns Manager for the Non-Communicable Disease Alliance. She actually comes with years of experience in the non-governmental sector. She has worked at various not-for-profits, including those focused on obesity, on child education, on alcohol, but more importantly now at the NCD Alliance, which all of us have tremendous respect for the work that the NCD Alliance does. She coordinates all of the policy and global campaigns work. What I think is really important is that we've engaged with Lucy in several fora, and I've just found it very instructive to talk about how, particularly from the perspective of civil society, from the perspective of NGOs, do we address this? So Lucy, over to you for your thoughts around the responses to COVID-19 and commercial determinants. Thank you very much for joining us today.
Thank you very much, Adnan. It's lovely to be with you all today. I guess I wanted to start with a quick question to follow on from Nick's presentation, which was terrific. I wanted to ask you just to think to yourself what the last unhealthy commodity industry practice was that you saw that rose questions in your mind. It made you roll your eyes or shake your head or made you wince. Because it was seeing these that made us start asking questions about how the industries have been responding to the COVID-19 pandemic. At NCD Alliance, we've seen and heard all sorts of kinds of behaviours from these industries for many years. And I'm sure many of you on the call have as well. And it's the sorts of things that push unhealthy products and practices into people's lives, which then go on to contribute to poor health for everybody, and developing risk factors for poor health and well-being, in particular around NCDs. So right at the start of the pandemic, we saw a continuation of that, and not just a continuation, we saw it in high concentration. So I'm going to talk a bit more about these. I'd really like to thank the Centre for inviting us to come and share some of our insights. I lead, as Adnan said, the work on prevention. And so this is a space that we've been monitoring very closely. And we have a particular interest in the unhealthy commodity industries that Nick referred to before, which are obviously at the more challenging spectrum, end of the commercial determinants of health spectrum. And I have a very strong interest in how these commercial sectors can also help, or other commercial sectors can also help at the positive end of the spectrum. Next slide, please. So when the pandemic kicked off, we really started asking questions around how, with NCDs catapulted into the spotlight, what were being defined as underlying conditions were doing, and how were they being implicated in the NCD, in the coronavirus sort of situation, the pandemic. So we listened very carefully to our alliances and members in our network and people living with NCDs and sought to really understand the implications. And aside from the increased vulnerability to the virus and the risk of disrupted care, which was already very poor for NCDs, we saw prevention become a bit of a mess amidst the lockdowns and industry responses, and we got quite worried. So our NCD lens is obviously long aligned with Nick's expanded definition. But in the context of COVID, we've really monitored not just the full spectrum, but we want to deeply understand how these challenges might be exacerbating NCDs in the long run. Next slide, please. So knowing how they were behaving and knowing how they behave most of the time, we joined up with some researchers through the Spectrum Research Consortium, who are based primarily in the UK, but do some work internationally, and sort of started trying to really, as I said, understand. And in the midst of the crisis, what we were hearing these mind-boggling tales about these industries, how they were pivoting their behaviour, and it was raising alarm bells. We wanted to understand how these industries, whose products and practices drive a large proportion of NCDs, were responding to the pandemic and the crisis, and what the implications would be for NCDs. Next slide, please. So as I said, we set out to understand this with the Spectrum Consortium. We primarily focused on the main NCD risk factors that have been identified that are modifiable: alcohol, ultra-processed food and beverages, tobacco, fossil fuels, infant formula and breast milk substitutes, gambling, gaming, but we didn't restrict to that. We were very open to hear what other people were defining as concerning in the context of NCDs. And we had multiple response categories that we were trying to understand, but again, we didn't restrict it. If others found they had concerns, then we wanted to hear about those as well. And so we put the call out to the broader network and asked for our alliances, for people living in NCDs, the wider global health community, to share examples that they were seeing. Next slide, please, of these industry responses. And so we closed just a couple of weeks ago the survey, and so we're right in the depths of analysis at the moment. So I'm going to share a bit of a quick overview, but please keep in mind that this is preliminary, very preliminary, and there is more to come. So there may be some variations in what I can share. So we had over 700 examples from at least 80 countries. Obviously, what we're seeing is not dissimilar to what we've seen in the past, and the analysis that we're doing is not dissimilar to what different organisations are doing on specific individual risk factors or behaviours, but we're looking at it across the lot and doing a bit of a thematic analysis. Next slide, please. As I said, the numbers are likely to change, but the trends are fairly similar. We had a majority of food, alcohol, examples shared with us, food and alcohol industry examples, but also others from tobacco, breast milk substitute, gaming, cannabis, fossil fuels. Many have been the very visible types, particularly marketing adaptations, PR exposure of CSR. Some have read between the lines and seen the policy responses of the industries that's also had an influence on policy outcomes. And we've seen some inappropriate health promotion examples, but I'll go into that in a moment. Next slide, please. So I'll just race through a few examples. As I said, I can't go into depth because I don't have time for 700 examples to be shared, but briefly, we certainly saw with the tobacco industry, there has been a lot of PR, a lot of lobbying in multiple countries, Eastern Europe, Latin America, European continent, Africa, a lot of CSR, and positioning themselves as essential to the response, at times leveraging any research that may have been coming out and confusing all the messages around that. And it's become quite distracting and confusing for a lot of people who are trying to quit using tobacco. Next slide, please. We've also seen the unhealthy food industry doing similar lobbying, but a lot more partnering to deliver food where schools were shut and school food was unavailable, doing a lot of CSR where positioning themselves again as very key to the response, but not necessarily providing healthy food options to communities that were particularly vulnerable, even providing access to testing services in vulnerable communities, but heavily branded as well. Next slide, please. Again, going onto this marketing angle where CSR has been one side of the more confusing parts of the marketing, but we've definitely seen specific pivots in marketing to jokes and distancing memes. We've seen PPE giveaways to healthcare workers in return for branded selfies. We've seen a lot of PR that when they said that they were going to turn off all their advertising on social media, we found that perhaps they didn't really need to worry about that because the free media exposure for their CSR was getting, and their fun advertising was getting them a lot of exposure anyway. Next slide, please. But particularly disturbing has been the alcohol industry response, and many of you will probably be aware of the way the alcohol industry has really tried to position themselves as fundamental partners to the COVID response, pivoting their production lines to develop sanitizers, partnering with charities and emergency services, launching health campaigns, lobbying, as I said, to be designated as essential, lobbying to try and get policy privilege and access to early opening. And this is all despite their complicity in harms such as around domestic violence during lockdown in South Africa and in other places. And even increasingly so, we're finding bars, for example, that are trying to open up early, but are just, we're finding are also hotspots due to alcohol-related behaviour. Next slide, please. As I said, we've seen the sanitizer production lines and often name dropping WHO for adhering to standards while plastering their bottles with branding and pushing HR and visibility, which has been very unsettling for a lot of people as well. We sort of question the objective. Next slide, please. And just finally in this set, we've seen a lot from the fossil fuel industry lobbying quite aggressively to position themselves again as fundamental economic actors, in some cases very successfully stalling and weakening policy that had already been set in motion to be implemented, getting tax breaks and fast-tracked infrastructure that has been very, very alarming for a lot in the climate response. Next slide, please. So as I said, we have got a lot of examples and there are more to come. We've put a few on the map here so far, so I'd invite you to have a scroll through that and see what's there so far, but look forward to the launch in a few weeks' time of more of those examples. Next slide, please. So I guess in the context of all of this and what else we're seeing around the world, I wanted to pick up on some of the positive angles that Nick alluded to before and think about what are the positive potential implications here and what's changing for NCDs. And we are seeing that much as COVID-19 is not something that any of us wanted to live through, there is a potential policy window. We're seeing a light bulb is going on amongst some policymakers. The long-time neglect of NCDs and risk factors and how they're exacerbating COVID-19 is becoming very pertinent, and we're seeing obviously that COVID-19 is exacerbating NCDs. So it's this vicious cycle that we're looking at how we can reduce the impact on the whole, and we're certainly seeing some governments trying to do that. So as I said, there's this realisation that health promotion and prevention are really fundamental to health systems and to health security and preparedness for these kinds of pandemics. That's a really positive shift for the NCD response. There's certainly now a shift back to or balancing with where capacity in health departments was diverted directly into COVID-19 response. We're starting to see traditional work on other NCD related areas starting to pick up. So we're looking at how we work on that and leverage that. And I think there's, again, as Nick alluded to, I think there's been an increased attention to the social determinants and we're actually seeing a lot more self-determination amongst those who are particularly challenged within that social determinant space, who are traditionally seen as more vulnerable and exposed to greater risk factors. Next slide, please. So again, in the context of what we're seeing, we want to sort of put out a word of caution, particularly to policymakers who are thinking about what to do to respond to COVID and NCDs at the same time. We've seen some really rapid policy responses, such as shutting down businesses, which has meant that some governments have found that they're very dependent on those businesses and thus open them up again. We've seen a few things that probably haven't been thought through around the non-COVID implications of the decisions and need to be thought through a bit more carefully. We have seen a lot of reasserted partnerships and collaborations, and if not previously put in place, they're new ones, and we feel that there's a big risk there around shaping the post-COVID response, so particularly around trade negotiations relating to Brexit, etc. It's a really alarming economic time, and so this dependence on unhealthy industries as economic actors in communities is very worrying, and there is a lot of lobbying from these sectors that is definitely putting at risk some of the great effort that we're putting into getting NCD prevention on the agenda. Industry interference, as I said, positioning as essential parts of the health, economic and social response is a big problem, and therefore we need the safeguards for conflicts of interest that are currently sometimes in place, sometimes spoken about, but very rarely held accountable, and need to address that. There's been a bit of an emphasis in any policy responses on lifestyle, which is the creeping inference from the industry. They like the personal responsibility onus. They like pushing behaviour change. It's very favoured. But despite the preference for policymakers and government and for industry to do this, it's stigmatising, and it's certainly incomplete in the context of options for responding to NCDs and prevention. And they're agile, they're cunning, and just when you think you know what's going on, they shift and they pivot their behaviour, as we've seen in this very concentrated way during the pandemic. Next slide, please. Oh, sorry, one back, please. Yeah. So again, I'm trying to look a bit more optimistically. So the window is open. How do we squeeze through it? So for the civil society community, I think it's really important that we listen and we see that there is increased chatter amongst policymakers regarding health promotion and prevention, and it's an opportunity to strike while that iron's hot, so to say. We are seeing some systems level win-win interventions, such as climate related active transport policies. We need to really push and encourage and support these kinds of interventions so that we're not just looking at climate responses, but also health benefits. We're seeing some countries attaching sustainability clauses to fossil fuel industries who are seeking out subsidies. As I said, physical activities being prioritised and promoted during lockdown. This is a big win. We're seeing some traction on obesity prevention. We're seeing increased recognition of alcohol's social harms and health harms, which again, I think we need to keep pushing hard on. There has been a growth of digital health literacy, and I think that's an opportunity for different sectors, different commodity sectors to sort of be involved in the response. We're certainly seeing that there is increased exposure around the complicity and influence of industry on policy making, and that need to regulate and not rely on soft policies. Recognition of tobacco as a non-essential commodity, I think, is again being asserted despite their efforts to leverage any evidence that may suggest otherwise. And we're also seeing, certainly in some countries, that there's traction on the concerns around gambling harm and the impact on mental health, and the really dire need for regulation in this space. So I think these are some of the spaces where we see some traction and that we should be leveraging. So in terms of the update on this report, we will be putting out a preliminary analysis around the Global Week for Action on NCDs from the 17th to the 13th of September. So I encourage you to keep an eye out for that and engage in the campaign, which is focused on accountability this year and certainly exposing industry activities and their influence on policy. So certainly engage in the campaign, but keep an eye out, because I think there'll be a lot that you will find very interesting. Thank you.
Great, well done. Thank you so much, Lucy. This is fantastic and really flowed very nicely from Nick's presentation earlier. I really enjoyed, first of all, congratulations on the survey. I think that's a huge contribution to the field of study of commercial determinants, as well as those around how to address NCDs. I'm really, really honored that you've, and I've gathered the 3 Ps here, that the industry is positioning, the industry is partnering, and the industry is still promoting, right? And they're still doing their core business. And your slide about making us aware and, to use your words, beware of all of these actions is incredibly powerful. So thank you again. So I'm really excited that now we have an opportunity to talk to our panelists about some of the issues that have been raised on the chat board. So I hope the 3 of you are ready to engage in a discussion. I'm absolutely happy for you to disagree with each other as well. So this is indeed an opportunity. And maybe, Nick, I'd like to start with you first and really talk a little bit about, pick up on your theme, which has been picked up in the chat board as well, about globalization of commerce. And do you think this is a time where things will fundamentally change? Are we seeing the possibility of new economic models to emerge? Do you think there's potential in that?
Well, I think it's important to be specific about what we mean. I think globalization is an irreversible trend. And I think rather the question is, who controls globalization? And I think, at least for the last 20 years or so, groups have talked about the differences between corporate managed globalization and globalization from the bottom up. And I think we've seen in the public health realm, globalization up, the Framework Convention Tobacco Treaty, the World Social Forum, and I think COVID-19 offers us another chance to say, what would global solidarity, collective action to control a pandemic and to control the huge burden that NCDs are imposing? I think it creates some opportunities for that. So to my mind, the question isn't globalization or not globalization, but who controls it, and to what extent can we shift the dynamic so that a goal of globalization comes to enhance human well-being rather than mainly to enhance corporate profits.
Lucy, do you want to comment on this specifically from the perspective of, do you think that the dominance of the private sector will continue? As folks on the chat board are talking, do we expect any change in the importance or influence of the industry?
I think it's really interesting. I think that we've got certainly multinationals that are often dominant in these conversations around the unhealthy commodity industries, but we have a lot of local bars, a lot of local producers of products that are still part of the problem. And in fact, they're considered craft, and yet they're picking up the habits of some of these bigger businesses. And because they're local, they're part of the community. So it feels harder to critique and challenge. And certainly some of the examples we're seeing is not just multinationals who are doing big picture work, but they're supporting the craft brewers, they're supporting the craft industries. And so I think the local it's still insidious locally. And I think even in smaller local communities, etc., where we're getting state-based or city-based responses, we're getting a lot of influence, and that's still impacting on how businesses are supported or operated and policies are made.
No, I think that's very, very true. Nino, what do you think about this? What do you think other ways when we can at least map these sort of economic flows and the relationships here over time?
I think that's a great opportunity to do. And going back to your question to Lucy, I really don't think that continuing as it has been done before COVID-19, I don't really expect much change in the activities or how they act or what they do in terms of corporations. I think it's broader public health communities' role should be increased in responding to this. Otherwise, I don't think that it's going to change much. As you can see, they're very quickly adapting to the new situation, and they are very, very well aware of the threats. So they're very well prepared, I think.
So Nick, big question. You've been a student of this field for many, many years. Tobacco is the white elephant in the room that is teaching lessons to all the other industries as well. We have the FCTC. We've had interestingly variable success over time, sometimes a lot, sometimes less. What do you think about the tobacco example? Do you have a couple of thoughts about positive and negative from there?
Yes, and I think there's still a lot to learn from tobacco, and I think their ability to operate at the global level, at the global and local levels, and to go back and forth between local, national, and global, we can all learn a lot from that. And that model of integrating different levels of action is something we should emulate. I also think tobacco control has done a very good job of working with civil society organizations and seeing the power of civil society movements. I do think that too narrow a focus on tobacco and commodities could lead us to lose sight of the real powers of the 21st century, which are the technology companies, the financial institutions, the banks, and I think they play a really critical role in promoting inequality in income, living conditions, and so on. And inequality is one of the driving forces, and the role of commercial actors in concentrating inequality is really something we have to take on in public health. And a narrow focus on tobacco, alcohol, and food won't by itself take us there. So I think we're struggling to find the right balance between learning from tobacco. A lot of my work is in the food sector, and I think there's still more to learn from tobacco and food, but also to broaden our look to really focus on the system of economic and political institutions that are worsening, health problems, including COVID.
And Lucy, do you think that despite all of the fantastic advocacy work of all of the NGOs, there's stamina in the world or political appetite for another FCTC, let's say one around alcohol or one around guns or one around food?
Oh, I think that, Adnan, we need to make sure that we're working with what we already have, don't we? I mean, we've already got human rights frameworks that we're not leveraging fully. We've got child rights frameworks that could integrate more around marketing. I think that we need to look at what we already have and keep working towards better things for what these bigger issues are around alcohol, etc., and food systems. But I'm a big advocate for sort of saying the FCTC was a big project, and it's not perfect even as it is. So I think there's a lot in the law space that would say certainly work towards it. But in the meantime, there's enough that we have to work with that we can make the most of if we do it well and coordinated.
So one of the interesting discussions on the chat has been about measurement. How do you measure things? So Nino, let me start with you by asking you, how can we map exposures to these various, and Nick is right, we need to go talk beyond just alcohol and tobacco, but to foods and to sugar sweetened beverages, but also, and I think Lucy mentioned this, even to cars. I mean, these are all potential commercial determinants of health. So any thoughts on measurement?
Of course. So this is a great question, and as I understand, and Dr. Nick furthermore can agree that measuring exposure and really understanding the direct relationship between commercial determinants and then health outcomes, it's pretty difficult job to do. But nevertheless, I think we as a public health community, we should try our best to start measuring as much as possible. Just giving simple examples on a population level, maybe just going out and doing whenever possible, either through digital health. In nowadays, for example, I'm conducting a study using SMS surveys just to look at the exposure to commercially produced foods, their availability, even during the pandemic in one of the communities in low and middle income countries. I think just starting slowly and understanding these things is very important, and calculating and measuring how big is the exposure. And I want to also echo Dr. Freudenberg's comment about like expanding our reach or focus outside those typical alcohol, food, and sweet beverages, and etc. to technologies. For example, I know that I've seen some recommendations for people engaging into active video games. So I'm a little bit split about this type of recommendation.
Yeah. No, and I think, Nick, from your perspective, do you think we have enough data? Do you think the step surveys and other traditional measures are giving us the right, even in this country, even in your country, United States?
Right. Well, I think we have huge amounts of data, and the task is maybe more to find new ways to organize and focus that data. I'm thinking of the work of Joanna Lima, who recently graduated from Oxford and is now at World Health Organization, and Sandro Galea on what they call the Corporate Permeation Index. I think a really interesting start to look to measure some of these things across countries. I'm working with a colleague, Kelly Lee, at the Simon Fraser University in Vancouver to begin to see how we could fit together a measurement of commercial influences with the global burden of disease approach. If we could get to a place, a very ambitious task, where we could say that the attributable fraction of mortality from tobacco or unhealthy food, this proportion can be attributed to corporate practices, and to look at its variation across health outcomes and across countries. That would really help us to focus public health activities, interventions, policies to take on the biggest contributors to the burden of disease. That's
that would be amazing, Nick, if we can come to that. Now, of course, GBD is disaggregated by classical risk factors measured in a very classical risk-based approach, but I think integrating the commercial determinants of health concept would be fascinating. And Lucy, I mean, your crowdsourced survey is in itself a new methodology in some ways. So is this better or worse than previous attempts by the NCD Alliance to get information? Do you think there are, have you learned any methodological lessons in doing this that you'd like to share?
Yeah, I mean, from NCD Alliance perspective, we have, we've got 65 alliances around the world and dozens of members. And so we've got quite an extensive network. What we've found is, obviously, as I said, there are some, our approach is very much to look at this as a cohesive issue. So drawing the themes across the different sectors rather than just looking at what the alcohol industry is doing or what the tobacco industry is doing, and see where the synergies are. And we're certainly seeing a lot of synergies around, corporate social responsibilities, positioning in terms of as a part of the solution. These kinds of things are certainly thematic. But what we are also finding is, aside from working on different issues, so the tobacco groups are looking at tobacco and the alcohol groups are looking at alcohol, we're also finding a change in sensitization levels. So the food groups sometimes understand how breast milk substitutes and infant formula are relevant and the behaviours of those, and alcohol and food isn't always necessarily understood that the behaviours are similar. So we're trying to link up those themes, and so there's a sensitization element to this. And so we certainly found that there was a mobilizing of the network, but I think we could go further, and particularly after this project, I think that part of what the benefit of this could be is that we have a civil society that's more attuned to what these different industries are and what their practices are. I mean, we've talked about the gaming sector, and there's certainly pros and cons to gaming. There's a lot of potential benefits in terms of socialization. People have found going into lockdown that they're networking more and getting those opportunities, but there's also severe mental health concerns around the addictive nature of gaming and the risks around co-risk factors with alcohol and ultra-processed foods. So gaming isn't necessarily on the agenda for a lot in the NCD space yet, but increasingly as we talk about mental health, it's becoming on the agenda. So I certainly think we're starting to see a shift in that and a greater awareness in the NCD groups around it, not just being big tobacco that's the problem when it comes to risk factors.
Lucy, while I have you, a very important issue has been raised in the chat board, which is that, look, there's tremendous amount of poverty and economic deprivation happening right now. But what we also know is that obesity is a huge risk factor for COVID-19. And obesity is, of course, an amazing, unfortunate risk factor for so many other chronic diseases as well. So the cheapest food available are unhealthy, and you have COVID-19. How are your advocacy efforts in this context going to shape up? What can we do to advise folks?
This is complicated. I mean, it's very, very important that we focus on obesity, but it's also very important we don't blame the victim. So we don't blame people living with obesity for having a greater risk of severity, given that so much of the circumstance around a person's development of obesity can be genetic, it can be predisposed in other ways, it can be environmental. There's mental health conditions contribute. It's so complex. So I think, if we step back a bit, I think what we're all talking about is healthier diets. We're talking about improved nutrition for everybody. And this is a food security issue. This is, the haves and the have-nots. This is for poverty and, people living in poverty. This is about education. It's a bigger story. And it's not just about one particular condition. It's about a much bigger story around nutrition that I don't know that we're quite grasping when we're talking about malnutrition in all its forms. I don't think we're quite managing to integrate it fully as we need healthy diets. We don't just need to feed people and solve hunger. We need healthy food to be feeding people.
And if I can add a few thoughts there.
Please, please.
I think the way in my group we've increasingly been thinking, what's the problem around the global diet? And we think that problem is ultra-processed food, food that is produced by the global food industry, high in fat, sugar, salt, and it contributes both to diet-related diseases, obesity, but also to food insecurity and to various kinds of undernutrition. And we think bringing together the public health community to have a clear understanding of ultra-processed foods and a much more coordinated strategy to address it would move things forward. And it falls squarely within this topic of commercial influences on health, as well as commercial influences on COVID, with the COVID diet-related diseases interlinked. I'll put in the chat session, a webinar we recently did at my institute on ultra-processed food that has some people from other parts of the world talking about this problem.
That'll be fantastic, Nick, and couldn't agree with more with both you and Lucy's response. I do want to pivot because I'm watching the time as well. We have only a few minutes left. Nino, alcohol. We've got to talk about alcohol before we end this discussion section. Talk to us a little bit about what Lucy said in her presentation, how smart these industries are becoming. What are your concerns related to alcohol, even right here in the United States?
Well, I mean, concern about alcohol is huge, especially in this country, as we can see in the initial days of the lockdown. I think in addition to grocery stores, pharmacies, these were only liquor stores that were fully open. And I feel like they had a huge opportunity to advance their cause, to say so. But I'm really very concerned about alcohol generally, not only during the COVID, but before and after the COVID. And I do really think that there needs to be more systematic way of approaching and addressing this issue. As everybody knows, I guess the tactics among these different industries are very shared, overlapping. And I'm afraid that without addressing them, we're not going to get to good results. And alcohol influences almost each and every single aspect of our life, both in terms of violence, without having proper conventions or systems or preventive measures for domestic violence, interpersonal violence. The diseases, non-communicable diseases, injuries. So I really think that there is a very strong need for addressing alcohol in much more systematic way.
Lucy, do you want to come in on this one, since you've raised the issue, and maybe identify a couple of specific items that you might recommend to us?
Yeah, so I mean, a couple of things to watch out for. So we're working with some alliances in Latin America and academics, including Thomas Babor and Catherine Rabina, Ilana Pinsky, who I believe is on the call as well, to develop a report on alcohol industry behaviour in the Latin American and Caribbean region. That's due to come out in August, and that's quite a phenomenal expose, I have to say, that will be really timely and certainly speak to what you're talking about, Nino. I think, I mean, that's not COVID specific. It's the general trends around alcohol industry exposure, and I think that will help to give a bit of impetus to civil society and also to governments to just sit up and be a little bit more acknowledging of the risks that they face when they sit down with these industries and accept the sanitizer in exchange for lenience in policy making. There's certainly the pivoting there has been really quite huge, and I think there's a lot of work to be done to be exposing it and talking about it and really challenging it. Even just labelling related conversations in the UK at the moment are talking about calorie labelling, but ignoring the fact that there's a cancer issue around alcohol. So there's all sorts of conversations that need to be happening now, and I think it's, as I said, I think there's a policy window and we need to squeeze ourselves through it.
And Nick, just to make sure we cover that, question about cannabis on the chat board. Any thoughts from you, particularly as laws in countries are being changed around this topic?
Yes, I'm going to give a short answer to that and answer one of the other questions on the chat. I worry a lot about cannabis. I think what we've seen for all the unhealthy commodities, the problem is when they come under control of giant corporations. Those corporations then concentrate, and they use their power to maximize revenues. I think we saw that so clearly in e-cigarettes, where there was maybe a small window of opportunity, but they got taken over by the tobacco industry and other big corporate players, and ended up spreading the nicotine epidemic to young people in a very dangerous way. So I think there needs to be much sharper public oversight of cannabis. I think there are worrying directions. I don't think it's harmless. I think the police response to cannabis that characterized the previous decades was also totally inappropriate, but I worry about it. I wanted to respond quickly, if I can, to a question from my friend Kelly Moltzen about corporate social responsibility, which I think is a really important part of this conversation. What's the role of corporate social responsibility? And I think we have some very positive examples from both tobacco and from climate change, where the action of faith-based organizations, public health organizations, the funds, insurance funds and others have been able to withdraw funds and really change the practices. In both tobacco and climate change, more than $10 trillion has been divested from each of those two industries as a result of corporate social responsibility. But I think, on the other hand, much of the rhetoric of corporate social responsibility, particularly the push to emphasize stakeholder rather than shareholder values, is mostly window dressing. And if you look at the corporations that signed on to the statement that came out around the time of Davos 2020 meeting about insisting on their adherence to stakeholder values. And what did they do around COVID? They cut wages to their workers. They increased wages for their executives, exactly the opposite. And so we in the public health movement have to ensure that corporations don't use the corporate social responsibility rhetoric to bamboozle us, to make themselves look good, to co-opt genuine public health reforms in order to enhance their image while not changing the fundamental determinants of ill health.
No, thank you very much, Nick. That was a great summary, actually, of some of the issues that we've all raised. Ladies and gentlemen, I'm going to start moving towards summarizing a few key points that I think and I hope you've heard today. First, I want to make sure that we are really joining the field of commercial determinants of health to add our voice from George Washington University Center on Commercial Determinants, to add our resources, to add our expertise and skill set, and to join all of you in this tremendous work that many of you have been doing well before us. So we acknowledge the contributions of people like the NCD Alliance and Professor Freudenberg and his group, and many of you on the chat board. But I hope that you welcome the energy and enthusiasm by which Professor Pachadze and others led by us are joining. Second, I really wanted to pick up on a comment on the chat board where the issue of Black Lives Matter has been raised, and the way that corporations and industry have responded to that by putting a one-page statement on their website that they stand with Black Lives Matter, or that they stand to try and influence racism, particularly in this country, in the United States. And yet, when you look at the actions of those industry, as Nick has just commented, there are no actions that follow suit. And so I think in this era where the very value of structural inequity, structural racism is being questioned, people are protesting about this, I do think we have an opportunity as well with respect to confronting the industry. I also want to make a point about how the determinants lingo has been used recently. So we always had social determinants of health, which in some way may be considered an umbrella term under which many different specific determinants may be considered. Our friend and colleague, Professor Larry Gostin, has published on the legal determinants of health and is talking about how that is important. Very recently, you'll see papers on the political determinants of health. And so we have that perspective to come. And then, of course, all of us are involved in the commercial determinants of health framework. I believe that these frameworks are equally valid and very complementary. The key is not about introducing a new framework, although as an academic, publishing a paper on that is always helpful. But what is more fundamental is whether we can use it as a strategy, as a leverage to actually influence policy, influence action. And that's where colleagues like Lucy and others in the civil society, in the alliances, in these international organizations become absolutely vital as partners. And so I hope that over time, our theories, our metrics that we've talked about, as well as our strategies, really come together to put together a forceful effort in looking at these individual risks, but also across these risks of commercial determinants. Please join me in, first of all, thanking Nick Freudenberg and Lucy Westerman for joining us today. It has been so valuable in hearing your perspectives and the work that you bring from your respective institutions. I want to thank the City University of New York for sharing your time and the NCD Alliance for sharing your time, Lucy. I also want to thank my own colleagues, led by Dr. Nino Pechadze, but also others like Ven and Imran and Lauren and Michelle and others who've been helping behind the scenes. And then thanks to all of you for joining us today. This was really our first webinar. Please watch out. We will be announcing our second webinar in the week that Lucy has pointed to, the week of the September 7th, as we celebrate the NCD Alliance week. As members of the Alliance, I should declare that we are formal members of the Alliance as well, and are very proud of that. We hope to do our next webinar focusing on a slightly different area. So watch out for that. For those of you who asked, this webinar has been recorded. We will be putting this on our website, and so you will have access to all the links and all the resources. Thank you all for joining. And I see many friendly names and colleagues. Thanks again, Nick and Lucy, for joining, and for my own team. Thank you. Wishing you all well, safety and health. Take care, folks. Bye now.
Thank you.